Thank you for joining the August ZOHU call. The webinar will begin soon. Please stand by. Thank you for joining the August ZOHU call. The webinar will begin soon. Please stand by. Good afternoon, everyone. I'm Ria Guy, and I work in the National Center of Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health office, I'm pleased to welcome you to the monthly Zoonoses and One Health updates call today, August 3rd, 2022. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have objections, you may disconnect now. Links to resources from each presentation are available on our website at cdc.gov/onehealth/zohu/2022/august.html. Next slide, please. Today's presentations will address one or more of the following 5 objectives. 1, to identify an implication for human, animal, and environmental health. 2, to identify One Health approach strategies for prevention of public health threats. 3, to identify a One Health approach strategy for detection of public health threats. 4, to identify a One Health approach strategy for responding to public health threats. Or 5, list 2 ways to improve collaborative practice across public health care teams. Next slide, please. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses or partners wish to disclose they have no financial interest or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to assure there's no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education, and the course access code is ZOHU Webcast. To receive free CE for today's webcast, complete the evaluation at cdc.gov/tceonline by September 5th, 2022. A captioned video of today's webinar will be posted at cdc.gov/onehealth/2022/august.html within 30 days. To receive free CE for the web on-demand video of today's webinar, complete the evaluation at cdc.gov/tceonline by September 6th, 2024. Got a full year there. Next slide, please. Before we begin today's presentations, Dr. Sean Chathamy, Senior One Health Advisor and Liaison to the Food and Agriculture Organization of the United Nations, and Acting Deputy Director of the One Health Office, will share some news and updates. So over to you, Sean.
Thank you, Ria. Good afternoon, everyone. Thank you all for joining us for the August ZOHU call, and we really appreciate you being here today. Before our presentations begin, I'd like to share some updates. You can find links to these resources in today's ZOHU call email newsletter. And if you aren't yet subscribed to the newsletter, please use the link at the top of the main ZOHU call webpage to sign up. Our response to the COVID-19 pandemic continues to evolve. You can check CDC's website for the latest guidance and resources, including information about keeping people as well as animals safe and healthy. While there is no evidence that animals are playing a significant role in spreading COVID-19 to people, we continue to see a variety of different animals reported with SARS-CoV-2. The latest animal case numbers are available on the USDA APHIS website, and guidance for pet owners, mink farmers, and many others are available on CDC's website. Next slide, please. Today's newsletter highlights a recent publication, a review of zoonotic disease threats to pet owners, a compendium of measures to prevent zoonotic diseases associated with non-traditional pets, such as rodents and other small mammals, reptiles, amphibians, backyard poultry, and other selected animals. Next slide, please. We also want to highlight a new publication in the Journal of Infectious Disease, Range Expansion of Native and Invasive Ticks, a Looming Public Health Threat, and recently published is the CDC-led 2022 special report on COVID-19 and its impacts on antimicrobial resistance in the United States. Next slide, please. We've shared links to several announcements and web resources, including bird flu in pets and other animals, and the Stay Healthy at Animal Exhibits web resource. Next slide. Here are some observances of interest. The International Conference on Emerging and Infectious Diseases, or ICEID, is in Atlanta next week, August 7th through 10th, and World Mosquito Day is coming up on August 20th. Next slide. Finally, we've included information on outbreak investigations, including a new salmonella outbreak linked to turtles and a listeria outbreak linked to ice cream. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases. We appreciate you sharing the ZOHU Call website link with your colleagues from the human, animal, plant, and environmental health sectors, and letting them know about the live webinars, video recordings, and the free continuing education credits this call offers. Our next ZOHU Call will take place on September 7th. And please continue to send presenter and topic suggestions for future presentations, as well as news from your organizations to zohucall@cdc.gov. That's ZOHUCALL at cdc.gov. Now, I'll turn the call back over to Rhea. Thank you.
Thank you, Sean. You may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You can also email questions to today's presenters, and we will provide their email addresses on this slide, actually, as well as on the ZOHU Call webpage for today's webinar and in today's email letter. Next slide, please. Our first presentation, Investing in Prevention, Getting and Staying Ahead of Antimicrobial Resistance Across One Health, is by Michael Craig. Michael, please begin when you're ready.
Thanks so much, and really appreciate the One Health office for having me on today. I'm Michael Craig. I'm the Director of Antimicrobial Resistance Coordination and Strategy at the Centers for Disease Control and Prevention, and happy to share some of the work that the agency's been working on over the past few years. I've talked on a ZOHU call previously and given some updates. I think we have some further updates that we wanted to give to you all and hear about some of the progress that we have been making across the agency and across One Health on antimicrobial resistance. Next slide. So I think this is probably not unfamiliar to folks who work on antimicrobial resistance, and for many of you, this is the burden of antimicrobial resistance in the United States. These numbers were released right before the pandemic, and I think give a very sobering picture of the threat that is faced by antimicrobial resistant pathogens in the United States, and that overall burden in terms of the number of patients that are infected, as well as the burden mortality burden, the number of deaths that we see each year because of AR pathogens. And I would just note to you, next slide, that even with those high numbers, we had seen and reported in that report that we had actually made progress in terms of prevention. So we had, even with those very sobering numbers on the previous slide, we had made progress, especially in our prevention of AR pathogens in hospitals. And this slide sort of shows what we reported in 2019, right before the pandemic, and the impacts that we were able to see because of real significant investments on the public health side, significant investments in hospitals and healthcare in terms of improving infection prevention and control and containment of AR pathogens. And I think that really showed us that prevention is possible. And I think, even with the high numbers that we reported on in 2019, I think it showed us that if we continue to invest in prevention, we will see success. Next slide. So the other sobering challenge, though, that we faced with the pandemic is the pandemic itself and its impact upon antimicrobial resistance. And this slide really gives you the bottom line from the report that was just noted, the AR COVID impact report that came out last month. I hope many of you saw it. It's available on the CDC website. And it really does provide, I think, a great snapshot. If someone says, well, what's the pandemic's impact been on antimicrobial resistance in the United States? This report, I think, distills all of those major impacts for not only human healthcare, but I think also touches on a number of other areas that CDC saw were impacted for community AR infections, as well as infections and issues that go and span One Health. So one of the things we'd note here is that on the previous slide, we noted that prevention is possible, but this slide and the data that we've seen coming out and the data from 2020 that we updated in that new report show that the pandemic has actually reversed that progress. And in fact, we saw the first year of the pandemic a rise in the burden of infections, particularly in the hospital, 15% increase in both infections and deaths from AR pathogens in the first year of the pandemic. So while we know prevention is possible and we showed what was possible prior to the pandemic's impact has directly reversed that and really set us back a number of years in terms of our prevention progress. And that really sort of notes our need to redouble our efforts. Next slide. So here are some of the things that we note from the pandemic that I think the pandemic has taught us, and I think that we see as directly translating to a lot of the issues that we deal with on antimicrobial resistance. We can't treat our way out of this pandemic, and that's very true for antimicrobial resistance. While we need to develop and improve the antibiotic drug pipeline, we really need to focus on prevention. And that focus on prevention means that we do need more tools and investments in prevention so that we can get ahead of the challenges that we see today and that we can get ahead of antimicrobial resistance. And if we don't invest in those, we are always going to be seeing those numbers in terms of infections and deaths increase. But if we invest in prevention, as the previous slides noted, we know that we can make an impact, make a difference, and save lives, and also save our valuable antibiotics. The other thing we'd note here is that we really do see that preparedness is prevention. And I like to say that because I think the more that we can do to focus on prevention, to prevent the infections and to prevent the day-to-day issues and challenges and epidemics like antimicrobial resistance that we face normally, the better prepared we are and the better equipped we are to be able to address unknown threats. And I think that the converse is especially true. If we can't adequately address the day-to-day threats, the known threats that we face like antimicrobial resistance, we're not going to be prepared to face the unknown threats. And I think that's something that we need to remind ourselves and we need to focus on in terms of our prevention investments. Next slide. So here are the 5 areas that we think are most critical for prioritizing prevention to fight antimicrobial resistance. I'll just note for you that these, cross well beyond CDC and public health. These are the 5 core things that we think need to be done to address antimicrobial resistance writ large. We see prevention in all aspects of these. Sometimes some of them, like vaccines especially, have more of a prevention component than the others, but we see that all of these have a core prevention component related to them, and it's a core area that we're investing in within the new CARB action plan. The CARB action plan combating antibiotic resistant bacteria is the US's national action plan, and we put a new one in place from 2020 to 2025. Next slide. So we'll just note, for the first CARB action plan, these were some major milestones that we accomplished with increased investment and increased prioritization in the United States. And these are some One Health milestones that would flag for all of you. So I think one of the key ones that we have invested in is establishing the Antimicrobial Resistance Laboratory Network, the AR Lab Network. I hope folks are familiar with it. It provides literally thousands of tests for antimicrobial resistant pathogens in the United States every year. You can see there, since its inception, it's conducted over 500,000 tests, including 250,000 whole genome sequences on AR threats across the One Health. And we really see this platform as a key to prevention and a focus on prevention, and looking across not only our healthcare pathogens, but are increasingly into our foodborne pathogens and environmental pathogens, and I'll touch on that in a moment. The other areas that would note is that we have really invested in state health departments, as you can see there, over the past few years, and since 2016, more than $500 million in state and local health departments we've supported total. And that has really made a major impact in changing our perspective and changing the way the US responds to antimicrobial resistant pathogens at the local level. And then the other thing I'll note is our support goes well beyond public health. We're investing in innovation efforts. So, new research and development into prevention, new ways of identifying pathogens, new ways of identifying, what are some of the environmental issues and the One Health issues related to AR pathogens, and how can we, better understand what is going on. There's some good examples there of some of our One Health research areas that we have focused on the past few years that have really made an impact, and we think are going to pay a number of dividends moving forward. Next slide. So this is an area that, would want to note for the coming 5 years as we look forward. The last slide was sort of what we have done to date, but what are we going to do moving forward? So these are some of the things that we're highlighting in the CARB action plan from 2020 to 2025, and that we really want to focus more on the environment. I think this is an area, especially on the One Health side, that does not get as much attention. I think that's shifting, especially for antimicrobial resistance. And we are very proud to be part of that shift and paying attention to what is the role of the environment in antimicrobial resistance? How does it potentially impact human health? How is it impacting animal health? What are the reservoirs in the environment where people are being put at risk, or animals are being put at risk? And how is the environment at play in terms of its ecology, in terms of pathogen movement, in terms of antibiotic or antifungal movement, and what is that aggregate impact having? Next slide. So one of the ways that we're noting, and I think you guys have probably heard quite a bit about our wastewater surveillance efforts at CDC related to COVID. One thing that I would note to you is that the work on the wastewater surveillance system and the new system, actually had some of its origins with an AR research project that we funded that was pre-pandemic, originally designed to test what the risk factors are for people who work at water treatment plants to actually get an AR infection. And so that methodology of sampling the wastewater treatment plants during the pandemic was then adapted and pivoted toward collecting COVID samples. So what we're very excited about is that now that news has been stood up, we're now furthering the methodology and really taking that foundation of news and going to be looking forward to then how can we adapt that toward AR pathogens and looking at different ways where we can look at effluent, and some of that effluent might be out of water treatment plants and seeing what the impacts of AR in the community might be. The effluent also might be out of healthcare facilities, and how can we test the effluent in, say, what's coming out of a nursing home or what's coming out of a hospital to better understand what might be going on in terms of antimicrobial resistance. Maybe there's outbreaks, maybe there's unidentified forms of resistance that we haven't actually, that the hospital hasn't caught on with yet, that might be circulating, and that might trigger a prevention response or an outbreak investigation. Next slide. The other area that we're highlighting, and this is true across One Health, is greater global investment. So this is an area that we didn't have the resources to support expansion of during the first 5 years of the National Action Plan, but the second 5 years, we are really prioritizing and have launched a new global AR lab and response network. So it's extending our domestic antimicrobial resistance response network globally. And so that we have sites that are looking at pathogens, where are they being identified? And again, this is across the One Health. We have a number of projects that are looking at not just what's happening on the human health side, but we're also looking at things that are happening related to potential foodborne disease. And we are also doing some sampling of the environment to, again, better understand what some of the connections are toward resistances and pathogens and antimicrobial agents that are being used environmentally, and what that impact might have on the pathogens themselves that are in the environment, and then the impact on potentially humans and animals. Next slide. So this is what our vision ultimately of the global AR lab and response network. We want countries, institutions, and partners to work together. So it is a very focus on collaboration to address the priority emerging AR threats and use a One Health approach. And so a lot of these projects in certain countries are starting with, say, a specific pathogen in a specific area. But what we would like to do is grow them so that more of these sites are doing more of a comprehensive look at not only pathogens, but at the One Health, taking the One Health perspective fully into picture there, so that we understand what are the intersections and interactions across One Health in the different site locations. Next slide. And that's the last I have here. I would just note to you that we have a number of ways to stay up to date on what we're doing on antimicrobial resistance. We have a fantastic investment website where you can see both what we're investing in state by state in the United States, as well as country by country around the globe. And I'd recommend that to anyone who's interested in learning more about some of our specific projects and what resources we're bringing to bear there. And I thank you for your time.
Thank you so much for your presentation, Michael. We appreciate all of your work on AR and One Health. Our next presentation, What You Need to Know to Prevent Zoonoses Associated with Fancy Rats, Bearded Dragons, Backyard Poultry, and Other Non-Traditional Pets. Update on a new resource from the National Association of State Public Health Veterinarians, is by Kate Varela. Kate, please begin when you're ready.
Thanks, Ria, and good afternoon, everyone. So again, my name is Kate Varela, and I'm a veterinary epidemiologist with CDC's One Health office. And I'm really excited to be here today to share information on this new resource from the National Association of State Public Health Veterinarians. Next slide. So for the purpose of this talk, non-traditional pets, or NTPs, refers to animals such as rodents and other small mammals, backyard poultry, reptiles, amphibians, and aquatic animals like fish. So recent surveys have shown that pet ownership has been increasing overall in the United States, and non-traditional pet ownership is also increasing as part of this. And over 13% of US households owned a non-traditional pet at the end of 2016, which was actually a 25% increase from 2011. And agricultural stores reported record purchasing of backyard poultry for meat, eggs, and to keep as pets in 2020. Next slide. So unfortunately, we also know that zoonotic disease outbreaks associated with a variety of pet species, including non-traditional pets, are becoming more common. And outbreaks have been associated with all of the animals pictured here. But it's important to remember that pets can appear healthy and clean, but still be carrying pathogens that can make people sick. Next slide. So anyone can become sick from a zoonotic disease, including healthy people. However, some people are at higher risk for serious illness or death from these infections. And people at higher risk of illness include children under 5, adults over 65, people with weakened immune systems like those living with HIV, AIDS, cancer, diabetes, or other diseases, people taking certain medications, including those that weaken the immune system like steroids, cancer chemotherapy, drugs used to treat autoimmune diseases and others, and pregnant women are all at higher risk of serious illness. Next slide. So to better understand the number of documented outbreaks and the types of non-traditional pets that have been associated with illnesses in people, we conducted a literature review looking at outbreaks in the United States from 1996 to 2017. And reports of outbreaks associated with non-traditional pet species during 2009 to 2017 were also retrieved from the Animal Contact Outbreak Surveillance System, or ACOS, which is part of CDC's National Outbreak Reporting System. Next slide. So from the literature review and the ACOS request, we identified 223 reported outbreaks and 20 case reports of illness associated with non-traditional pets from 1996 to 2017. And an outbreak here was defined as 2 or more people with documented illnesses, whereas a case report was just 1 ill person. Next slide. And 198 or 81% of the outbreaks and case reports in people associated with non-traditional pets were attributable to Salmonella bacteria, with 62 outbreaks and 6 case reports of human Salmonella infections associated with reptile contact, 105 Salmonella outbreaks in people associated with backyard poultry, 17 Salmonella outbreaks associated with rodents and other small mammals, and 8 Salmonella outbreaks associated with fish and amphibians. Next slide. And additional infections in people associated with rodents and other small mammal contact were LCMV, monkeypox virus, sole virus, rat bite fever, and tularemia. Next slide. And this resulted in a total of 9,875 human illnesses that were attributable to these pathogens, with 15% occurring in children younger than 5 years old. In addition, 18% of people infected were hospitalized, and 33 deaths were associated with these illnesses. Next slide. So given the number of outbreaks and illnesses occurring due to contact with non-traditional pets, and the fact that non-traditional pet ownership is increasing, we recognized that a new resource to prevent these outbreaks was needed. And we've been using a One Health approach to develop a new guidance document in collaboration with the National Association of State Public Health Veterinarians, or NASPHV, and a committee of experts from government, academia, industry, and private practice. And it's called the Compendium of Measures to Prevent Zoonotic Diseases Associated with Non-Traditional Pets, such as rodents and other small mammals, reptiles, amphibians, backyard poultry, and other selected species. And as we were developing the document, we really tried to include a One Health lens in terms of the target audience. So there are specific sections for veterinarians and their staff, human healthcare providers, the non-traditional pet industry, including breeders, retailers, and distributors, government agencies that are involved in disease prevention and control, and other partners. Next slide. And the new resource summarizes the common non-traditional pets and the associated pathogens that are reported to cause illness in people associated with these pets, recommendations to prevent these diseases, lots of free communication tools for veterinarians and other partners, and additional resources. And I'm really happy to say that this was published in a special edition of Vector-Borne and Zoonotic Diseases this past June, and it's open access, so it's free for you to download and use as you would like. Next slide. So the document is organized into background information, general recommendations, partner-specific recommendations, and appendices. And there's a lot of information in there, but I would recommend that you take a look through to see which sections are most applicable to the sector that you work in, if you can't get to reading the entire document. And I just also wanted to point out that the appendices have a lot of valuable resources, including an additional table with selected zoonoses. So just a sort of high-level summary of many of the different pathogens that these animals could potentially carry. There's a glossary in case you have questions about the terminology. There's also a new graphic that describes how non-traditional pets are bought and sold in the United States, so the industry layout, as well as guidance on safe animal handling in various settings. And there's a lot of handy links throughout the document to resources, including printable materials that can be shared with pet owners. Next slide. So in the background information, we have information on each of the species or different types of pets, as well as the pathogens that have been associated with outbreaks related to contact with these species. And then each of these sections in the background also includes information on risk factors for transmission, special exposure settings, specific antimicrobial resistance concerns, animal distribution and purchase information, and then occupational health considerations as well. Next slide. And as we were developing the document, we really wanted to emphasize that all relevant One Health partners should really work together to communicate to the public and to non-traditional pet owners a consistent message around how to prevent diseases associated with these animals. So in the compendium itself, we describe the roles of One Health partners in zoonotic disease prevention from non-traditional pets. And I'll touch on the roles of each of the partners briefly here. So it's important that veterinarians discuss responsible pet ownership, how to choose an appropriate pet, animal husbandry and welfare, and preventive care with current and prospective non-traditional pet owners. And to bring a One Health perspective to their daily work, veterinarians can also let pet owners know that they should tell their healthcare providers about what pets they have at home and the animals that they come into contact with outside the home. So whether it's at school, daycare, at birthday parties, etc. And this information would be helpful to get a faster diagnosis for the person in the case that they are infected with a zoonotic disease. And it could also help identify if an outbreak was occurring in the community and potentially even help stop it faster. And of course, we know that veterinarians and vet staff are at risk of zoonotic diseases just by the nature of their job. So it's also important to be aware of and share resources with your staff on how to prevent disease transmission. Next slide. Physicians and allied healthcare providers also play a critical role in zoonotic disease prevention. And they can routinely ask patients if they interact with animals at home or away from home and what types of animals they come into contact with. They can discuss disease prevention precautions such as proper hand washing with patients who are non-traditional pet owners or who might be at risk of occupational exposure. And they can also advise people at higher risk of illness which types of animals to avoid. Next slide. In addition to outbreak response, public health and animal health officials can provide resources and outreach to the community to inform and educate constituents on relevant local, state, and federal laws related to non-traditional pet ownership. They can also provide resources on zoonotic disease risks associated with these pets and share evidence-based zoonotic disease prevention methods with their communities. Next slide. And industry partners such as non-traditional pet breeders, distributors, and retailers also play a critical role in zoonotic disease prevention. And some important steps that industry can take are to educate animal owners at each level of the non-traditional pet supply chain at which a consumer might be selecting, ordering, purchasing, or adopting a non-traditional pet. And it's important to include here online marketing and sales as well. Industry can also educate all employees about infection prevention for themselves and customers. And it's really important that they educate employees on how to communicate zoonotic disease prevention information to current and potential pet owners. And this is really critical and I want to emphasize it because a retail pet store employee is often the first person that a non-traditional pet owner may interact with to learn about these pets. So employee engagement in this process is really critical. Next slide. So the recommendation section of the new compendium includes general messaging that all One Health partners can share with pet owners. And some of this language you could even just, lift it out in your day-to-day use in your day-to-day communications. You can put it on your own handouts. So we tried to make it really usable and user-friendly in terms of the messaging that was included. And I wanted to share a few key pieces of information from the recommendation section that are really relevant for all partners who might be on the call today. And this includes sample messaging, as you can see here, for pet owners on picking the right pet. So some non-traditional pets are not recommended for households or settings where there are people at higher risk of serious illness. And generally, we don't recommend amphibians, backyard poultry, feeder animals, reptiles, rodents, and some small mammals in these households or settings. We don't recommend that households with children younger than 5 keep pet ferrets because there have been multiple reports of ferrets inflicting severe injury on infants and young children. And in general, we don't recommend that people keep venomous or toxin-producing animals or wild animals as pets. Next slide. And here's some sample messaging that you can share with pet owners or prospective pet owners on how to select the right pet for themselves or their family. So of course, before getting a non-traditional pet, you want to research the pet to make sure it's a good match for you and your family. And that's especially true if you have young kids or older adults in your household. You should talk to a veterinarian who specializes in exotic animals or backyard poultry, depending on what you're considering. And then purchase or adopt from reputable sources. And on the next slide, I'll share some red flags for some less reputable sources to keep an eye out for. Check state, local, or property laws and ordinances before purchasing or adopting. Of course, when you're picking a pet, pick one that appears healthy and make sure that the other animals in the enclosure or the group that they're coming from also appear healthy, because if not, they may have been exposed to something that might not show up till you bring your pet home. And then purchase or adopt captive bred animals. And that's because they're more accustomed to people and living in captivity than animals that weren't bred in captivity. And you also have a better idea, and you can get more information about the health history of the animal if it's been captive bred. So there's several reasons why buying captive bred animals is important. When you're buying from a retail store, there are some rules of thumb to keep an eye out for. So look for knowledgeable store employees, a clean store with a pleasant smell, clean habitats with adequate lighting, and then you can even ask about written pet wellness policies and pet care policies and even pet return policies to see what options might be if you do end up having a pet that needs medical care or has any other issues. Next slide. So here's just some things to avoid when purchasing or adopting a non-traditional pet. To get back to that for a moment, you're going to want to avoid internet sales from unknown sources, swap meets and flea markets, roadside stands, and retailers that are selling animals as a side business. And that's really because these types of outlets, with them, you don't necessarily know the biosecurity practices, the animal's health history, how they were cared for, or whether they were captive bred or wild caught. So there's a lot of red flags and unknowns with these types of retailers. Next slide. And here we have some sample messages for pet owners. So now that they've picked their pet and brought it home, how to prevent contamination at home. So it's important that pet owners realize pets can contaminate surfaces in their home with germs and that they don't actually have to touch the animal to get sick from them. So to prevent contamination, they should keep pets and supplies out of the kitchen where food is prepared, served, stored, or eaten. Clean supplies, including habitats and accessories, outside the house when possible, though we do recognize that a lot of times people get these smaller non-traditional pets if they're living in a smaller space or an apartment, so they might not have an outside area to clean the supplies. So if they are cleaning them indoors, to use a laundry or utility sink or a bathtub, and then to thoroughly clean and disinfect the area right after. And to never use food preparation areas to clean non-traditional pet habitats or anything in their habitats. And to avoid cross-contamination, to use cleaning materials like sponges or brushes that are really dedicated for these purposes, to keep them separate from those used for routine household cleaning. And additionally, to avoid cross-contamination, it's really important not to allow non-traditional pets to roam freely in the home. And this includes backyard poultry and even chicks, even though they are super cute. And people do tend to want to bring them inside. Next slide. So quickly, I just wanted to also share that the National Association of State Public Health Vets has many other helpful guidance documents and recommendations on their website. So they have disease-specific documents like for rabies, brucellosis, psittacosis, and others. And then there are setting-specific recommendations. So for prevention of diseases for animals in public settings like fairs and petting zoos. And then there's even one, if you're looking to boost biosecurity in your veterinary clinic, there's a document on that too. And there are links to these in the non-traditional pet compendium, and also you can find them on their website. Next slide. So the human-animal environment interface will continue to be an important factor shaping human health needs, and a One Health approach is and will continue to be critical to zoonosis prevention and control, including from non-traditional pets. So we really hope this new resource will be a valuable tool to prevent future outbreaks. Next slide. I just want to say thank you to the compendium co-authors and reviewers listed here. And you can go to the next slide. And thank you again so much for your time.
Thank you so much, Kate. We're really excited that this new resource is now publicly available. Next slide, please. Our final presentation, No Meat for You, Updates on the Tick Bite Meat Allergy, Alpha-Gal Syndrome, is by Johanna Sauser. Johanna, please begin when you're ready.
Yes, thank you. Thank you for having me. So I'm a veterinary medical officer leading the epidemiology team in the rickettsial zoonoses branch at CDC. I'm in the division of vector-borne diseases, and today I'll be talking about an emerging disease we study that is actually an allergy. So I plan to give an overview of alpha-gal syndrome and why this disease matters to One Health professionals. Next slide, please. Alpha-gal syndrome is the tick bite-associated allergic reaction to red meat. The disease was first identified in the United States in 2009, although we have evidence that it existed starting years prior to this. It is associated with a delayed allergic reaction, atypical of other foodborne allergies. Patients can present with a range of symptoms, from gastrointestinal to anaphylactic reactions. Reactions can be severe and possibly fatal, requiring ER visits and patients being prescribed EpiPens. Next slide. So you may be asking yourself, why are we talking about an allergy in the zoonotic and One Health updates? Well, a zoonotic disease refers to a disease caused by a pathogen, such as a virus or bacteria, which is transmitted between animals and people. Clearly, alpha-gal syndrome is not caused by a pathogen and not a zoonotic, but it is associated with tick bites. The presence of ticks in environment and risk of tick bites to people is highly dependent on the presence of animals and their ability to harbor ticks. We can easily draw some assumptions that in an environment where ticks are at high burden and on domestic animals with close contact with people, people are likely at increased risk of developing alpha-gal syndrome. We're currently analyzing a case control study that finds environmental risk factors for alpha-gal syndrome are similar to other zoonotic tick-borne diseases. Lastly, a cornerstone to One Health approach is prevention. So, and although animals aren't thought to be impacted by alpha-gal syndrome, protecting people from acquiring alpha-gal syndrome involves tick prevention for people and also their animals. So, although not a zoonotic disease, control and prevention of alpha-gal syndrome relies heavily on a One Health approach. Next slide. So what is alpha-gal? Alpha-gal syndrome is caused from an allergic reaction to alpha-gal, and alpha-gal is a shortened name for the sugar molecule called galactose alpha-1,3 galactose. It is an oligosaccharide found in most mammals except humans, apes, and old world monkeys. This molecule is also found associated with the glycoproteins secreted in tick saliva. Next slide. So where is alpha-gal found? Not only is it found in red meat and dairy products, but it's also in medical products such as gel caps, some antivenoms, and heparin. Some vaccines may also contain a small amount of alpha-gal, and more sensitive patients can also react to these medical products as well. So we can see how having this allergy but not fully understanding what products contain alpha-gal can be a real source of anxiety for patients. Next slide. Until recently, failures of xenotransplants were considered in part due to the presence of alpha-gal in donor animal tissues. So many of you may have heard about alpha-gal more recently with reports of the first successful xenotransplant in a man with an alpha-gal-free pig heart. So this was a pretty big breakthrough for transplant medicine. Next slide. Symptoms differ person to person, and also within the same person, with an individual's reaction to the same product being consistently inconsistent. The reactions are delayed, which is unique among these food allergies, with shorter reactions, though, occurring when a medical product is given. So such as an IV product, you would see a shorter reaction time. Symptoms can range from hives to GI symptoms to anaphylactic reactions requiring emergency attention. Because of the delay in reaction, many patients report symptoms occurring in the middle of the night, so approximately 6 hours following a big dinner that contains meat. Next slide. Diagnosis of alpha-gal syndrome is done through the identification of specific IgE antibodies to alpha-gal. Although less reliable, skin tests for reactions to mammalian products can also be conducted. A detailed patient history and an understanding of how and when symptoms occur should drive the healthcare provider's decision for testing. For more details on diagnosis and management, I put an image down here that's referring to a 2020 article by Scott Cummings that goes into much more detail in the diagnosis and management. Next slide. So the reason clinical evaluation is so critical for diagnosing alpha-gal syndrome is that not everyone that tests positive for alpha-gal specific antibodies will have clinical alpha-gal syndrome. The testing is not very specific, and in some studies, particularly those conducted in areas where there's a high burden of Lone Star ticks, we can see upwards of 1/3 of control patients having antibodies to alpha-gal, but not clinical symptoms. So the working idea is that a portion of people bitten by ticks will develop SIgE antibodies, although some people have SIgE antibodies but have no recall of tick bites. And then a small subset of these individuals that have positive antibodies will develop clinical alpha-gal syndrome. It is still unknown how other exposures can cause SIgE development in a person, and also how host and environmental factors may impact developing clinical disease. Next slide. So diagnosis has been considered heavily patient-driven, and often these cases are self-diagnosed without testing. So this is some data here from an older report of alpha-gal patients in 2016 that found only 21% of those were diagnosed within the first year of symptoms. The remaining 79% took an average of over 7 years to be diagnosed, with many ER and medical visits. We are actively working on assessing healthcare provider knowledge and education and developing educational material to target these gaps in patient identification. Next slide. So the distribution of people diagnosed with this allergy is global, covering 6 continents. The tick species considered to be associated with the allergy varies across the globe, with some areas linking Ixodes species with alpha-gal syndrome, although evidence is lacking in the US to point to Ixodes species of ticks linked to clinical disease for alpha-gal syndrome. Next slide. This map includes stars and dots from a study in 2011 indicating the distribution of cases of patients with red meat allergy testing positive for IgE antibodies to alpha-gal. So I've overlaid these points onto a CDC distribution map showing the range of the Lone Star tick to highlight the initially noted similar geographic distribution of alpha-gal syndrome cases and specifically the Lone Star tick. So we know from these earlier studies that the distribution is similar to the Lone Star tick, although cases have been reported now outside of this range. Next slide. So this map is from a recent study examining SIgE testing results from commercial lab from 2010 to 2018. So although there are many more points used to develop this map, you can see that the geographic distribution continues to follow a very similar pattern as these earlier studies, which follow the same geographic distribution as the Lone Star tick. Next slide. So much of the initial pointing to ticks was related to the distribution of human cases and other international studies. But what is it about the ticks that trigger alpha-gal syndrome? So earlier studies from both Europe and Australia reported that the presence of IgE antibodies to tick saliva proteins in sera from patients who experience anaphylactic reactions to tick bites. And in the graphs here from a 2011 study by Scott Cummings and others used whole body extracts of Amblyomma americanum on the left, which is the Lone Star tick, and Dermacentor variabilis, the American dog tick, which is on the right. Using sera obtained from alpha-gal syndrome patients in Virginia, these figures show the correlation between IgE antibodies to alpha-gal and IgE antibodies to proteins derived from the ticks. The results on the left show a strong correlation between IgE antibodies to the Lone Star tick and IgE antibodies to alpha-gal. This provides more evidence of tick bite, and specifically a bite from a Lone Star tick can induce both IgE antibodies to tick proteins and alpha-gal. Many additional studies have identified alpha-gal in the saliva glands of both Lone Star tick and black-legged ticks, and additional work has been done to hone in on the details of how tick saliva exposure triggers alpha-gal syndrome. Next slide. More recently, and not yet published, our team at CDC has partnered with the University of North Carolina and conducted a case control study. History of self-reported tick bite was collected from case patients and controls. The self-reporting includes tick bite noted in the year prior to symptoms for cases or year prior to interviews for controls. 88% of case patients and only 47% of controls reported tick bites. Case patients were over 11 times more likely to report finding a tick on their body. And in general, case patients reported finding more ticks than the control group. Cases were 4.2 times more likely to report finding at least 10 ticks on their body rather than 0 ticks when compared to the controls. Next slide. The seasonality of alpha-gal syndrome reported first episode or symptom onset is in the same case control study is depicted in the graph on the left and is similar to findings in other studies. These results in seasonality mirror what you would expect for tick-borne disease associated with the Lone Star tick, such as ehrlichiosis, which is graphed on the right. Next slide, please. So now to cover the burden of disease and what we know and don't know. The graph on the left shows the upward trend in testing for SIgE antibodies from 2010 to 2018, published in a recent CDC study. In this time period, 122,000 tests were requested to a commercial lab, representing 105,000 individuals, of which 1/3, or approximately 34,000 individuals, presumably symptomatic, had at least one positive test result for SIgE antibodies to alpha-gal, suggesting that alpha-gal syndrome is an increasingly recognized public health problem. This is likely just the tip of the iceberg of cases, since anecdotally we know, as we've already discussed, that many people self-diagnose and the tests are never submitted. Next slide. Patients may never fully recover from alpha-gal syndrome, but through medical management and behavioral changes, symptoms can be mediated. Management includes avoidance of products containing alpha-gal, and medications are prescribed when needed. Additionally, it is suspected that additional tick bites are associated with elevating SIgE antibodies and the reoccurrence of reaction in these alpha-gal syndrome patients. Therefore, tick bite avoidance is recommended for management. Over time, some patients may be able to slowly introduce meat and other products back into their diet. Next slide. Tick bite prevention is important for both preventing alpha-gal syndrome in those who don't have the disease and reducing reactions in patients with alpha-gal syndrome. Prevention can be achieved using a One Health approach and preventing ticks on pets through tick prevention products and controlling ticks in the environment. When in areas suspected of ticks, tick checks on people and dogs are also recommended. For more on how to prevent tick bites on people, pets, and in the environment, CDC has a very helpful website and communication material with a link here. Next slide. So CDC and state and local health departments have taken big steps in the last year or so to approve a standardized case definition in order to initiate voluntary national surveillance for alpha-gal syndrome. We've developed a national case report form, and a few key states have already started conducting surveillance on their own. Our team at CDC has also initiated testing-based surveillance to further understand where people are being tested and where these positive cases are being diagnosed. Next slide. So in conclusion, alpha-gal syndrome is likely the most emerging tick-borne disease in the US. We're only beginning to understand the burden and impact of the people in the United States, and doing so through this voluntary national surveillance. We also know that there's a pretty big gap in who has the disease and who actually gets tested and counted in our surveillance systems. We haven't yet answered the question of why now, but we have study plans at CDC to work with other experts to understand what has actually changed to cause the emergence of cases. So we have many questions remaining about the disease in order to best prevent people from getting alpha-gal syndrome and to help with the proper diagnosis and medical management of those patients. So public concern continues to grow, and so does the public health activities and research conducted at CDC and other institutions. Next slide, please. So thank you all for taking time to learn a little bit about alpha-gal syndrome. Please visit CDC's alpha-gal website for more information, communication materials for both the public and healthcare providers, and other scientific references. And thank you again.
Thank you so much, Johanna, for the information you provided on this interesting and peculiar syndrome. And thanks to all of today's speakers for their informative presentation. Links to resources for each of these presentations, as a reminder, is available on our website at cdc.gov/onehealth/2022/august.html. And it does look like we have time for a few questions. So please use the Q&A feature in Zoom to send your questions on and include the speaker's name and topic when you do so. There's a few questions in the chat box. The first is for Michael Craig. So Michael, the person asks, pharma companies are not investing in bringing new antibiotics to the market. One, because they are very costly to develop, and two, they are not profitable to companies. What kind of work can the CDC do in line with the WHO call for new antibiotic development to promote this work?
Thanks so much for the question, and it's actually quite timely because I'll just note to you that CDC and FDA are hosting a meeting later this month, August 30th. It's a virtual meeting, so it's open to anybody who'd like to join, and we can share the information with it. There's a public website where you can find the information on it, and we can share that. But the meeting is actually specifically focused on new prevention products that could be used to fight antimicrobial resistant infections. And part of what we're flagging for FDA and what we're trying to note is that there are some new agents that are coming to market that could be used for treatment of antibiotics, but they could also be used for prevention purposes, for things like decolonizing an individual that is a carrier of a resistant pathogen. And what we're noting is that the market potentially for the prevention modality of some of these treatments is much larger than it is for the actual treatment. So the number of people who are colonized with an AR pathogen is much more than the number of people who have an active infection. And so that's something that we're noting and wanting to highlight this so that we can potentially find maybe a new pathway, a new regulatory pathway to bring these prevention products to market. And that new approval pathway might be able for some agents to actually be an additional market and an additional incentive to invest in this area for AR infections. So I think that's an area that we definitely see a need for, and we're trying to work with FDA on.
Thank you so much, Michael. Another question for Kate Varela. They say this is more of a comment than a question. Dr. Varela mentioned that captive bred pets are more likely to have a healthy history. However, it's also very important to purchase captive bred animals for species that are commonly sourced from the illegal pet trade. For example, turtle trafficking is a huge problem in the United States and globally. Kate, any thoughts or comments on that?
Yeah, I think just thank you for that comment. And I definitely agree that that is another important reason to purchase captive bred animals. And we, that is also mentioned in the compendium. I didn't bring it up, but I appreciate the comment and definitely agree. Thank you.
Thank you, Kate. Another question for Johanna Salzer, our last presenter. Does alpha-gal allergy reaction, is it possible with mosquito bites as well?
Yeah, that's a good question. So no, not that we know of. I think we would also see a different distribution of disease as well. There is some thought that possibly people who are more sensitive to other stinging insects, there's like an association with being very sensitive to stinging insects and developing alpha-gal, but we're hoping to answer some of that actually in our case control study.
Thank you, Johanna. There's another one for you. Are there plans to get this information out to the general public with postings in parks and other places, like as is done with Lyme disease?
Yeah, this is a great question. And we've had a lot of, so we do have plans for this. And we've had a lot of discussions about the public perception too of alpha-gal syndrome, and if alpha-gal syndrome and these notifications in public places where people are at higher risk may actually motivate people to take more preventative measures to prevent tick bites than they would for some of our other tick-borne infectious diseases. So telling someone they might have an allergy that could be lifelong might actually motivate them put on DEET or put permethrin on their clothing and check their dogs for ticks versus, ehrlichiosis or anaplasmosis or even Lyme disease. So yeah, so those are in the works.
Perfect. Thank you so much, Johanna. It looks like we're at time. So if others have questions for today's presenters, we've included their email addresses on the slide that you see now. It's also on the ZOHU Call webpage for today's webinar, and it's in today's email newsletter. As well, a video of today's webinar will be posted within 30 days. Next slide, please. So please do join us for our next ZOHU Call on September 7th. Thank you all for your participation, and this ends today's webinar. Goodbye, everyone.